We'd like to welcome everyone this morning to our weekly update. My name is Lance Madigan. I'm with the Intermountain Communications team, and we're excited this morning to be joined by Dr. Tamara Sheffield, Medical Director for Preventive Medicine here at Intermountain. Flu season is coming up, something we've been looking forward to, of course, and it's time to get our annual flu vaccination. As we've been talking COVID vaccines for a while, we didn't want to lose track of the importance of getting your flu vaccine at this time of year. So, Dr. Sheffield, when is the best time to get your flu shot?
Well, Lance, as you're aware, in the last couple of days, we've started to feel that cold fall and had quite a kind of cold snap. And, most people think it's about time to start bedding down your garden and winterizing your home. When this happens, I always think first of flu vaccine. It's time to get your flu vaccine. And the CDC recommends that October is our prime time. So tomorrow, it's October 1st, and it's time to go on in and get our flu vaccines because we want to make sure that we have the immunity built up from the vaccine to protect us when we start seeing cases of influenza. And those can usually happen towards November, December. We start to see cases. The majority of our cases usually happen in the January and February timeframe.
Great. Why is it important to get a flu shot every year?
Well, I think specifically this year I want to focus on because what we have right now is a full healthcare system. We have our hospitals are full with COVID patients, our ICUs, and just like last year, we were very concerned with so many cases of taking care of those who were very ill with another respiratory virus that we didn't want to have a second one that would be putting people in the hospital and would be filling up those beds and making it unavailable for others who need care. So it's very important, just like last year, this year, to get our influenza vaccines. And interestingly enough, last year, our rates were actually much lower going into the indoor season. So when we start passing viruses around, it's when we gather indoors, when we are sharing airspace, and when we're gathered at schools. And last year, everybody was doing a really good job of social distancing and masking, and we're not having those same behaviors this year. We have a lot of more individuals who are out in the public, unmasked and gathering in big gatherings as well. And so we have a much higher chance of passing both the COVID virus as well as the influenza virus as we're moving now into the indoor settings. So it's very important for us. Interestingly enough, last year we also really had a big push for the influenza vaccine and gave in our own system 6% more doses than we'd given in the previous year. So by vaccinating really well, by having those protective measures, we had an extraordinarily mild flu season in that we had in January and February, when I usually in my tracking see 1,000 cases per week, we had 0 cases. No cases of influenza, also another respiratory virus, 0 cases of respiratory syncytial virus, because we were being very protective in our behaviors and not passing those viruses between us. So it's critical this year, since we haven't been and aren't being as careful. We are starting to see a few cases of influenza pop up in our community now in our testing. So those 0 cases are no longer. We don't know what the season will be like. It was pretty mild down in the southern hemisphere, which we look at because they just finished up their winter, and we're moving into ours. So it's still possible we'll have a milder season, but usually when you've had some mild seasons, the next season will be pretty large for influenza. So whenever it does kick in, if it's this year or if it's next year, we would expect a more virulent and higher number of people getting ill.
Yeah, that's a good question. Talking about what we might expect from the flu season this year. I know sometimes we can get some indication from the Southern Hemisphere. Do we have any kind of insights or thoughts other than last year was weak and we may be in for it this year?
No, really, you can never predict. Until the flu season happens, we don't know what's going to happen. So that's why we have to be vigilant and prepare every year for it. And just to bring that point, I mean, some seasons have lower rates of hospitalizations or higher, lower rates of death and higher, but it's an extraordinary number every year. If you look at uh, the even just a couple of seasons ago, that was considered a mild season, and yet we still had 38 million people become ill with influenza, 400,000 hospitalizations, and 22,000 deaths. And that was a pretty mild year. Our deaths can range anywhere from 20 to 60,000 a year. So we're talking about, this is a pretty bad actor, this virus. The nice thing is the vaccine in that year prevented 7.5 million cases, 3.7 million visits to the physician, over 100,000 hospitalizations, and it prevented 6,300 deaths. So the vaccine does reduce the number of hospitalizations that we have and the deaths. And so it really is important for us this year, when we have our hospitals full, to make sure that we reduce the number of influenza cases. And let me just describe a little bit about what influenza does to you and your body. When the virus gets into your lungs, you have these cells called that have these little fingers or fimbria. They're kind of like feathers, and they move and take the things that we breathe in, the bacteria that we breathe in through the air, the dirt that we breathe in. It's like a vacuum, and it cleans out your lungs. It keeps your lungs clean. Well, influenza paralyzes those cilia, and so you can't really clean it. So that's where we get cases of pneumonia, when that bacteria gets lodged in your lung. You can get ear infections, you can get sinus infections. And we find that people who have chronic diseases, such as heart disease, lung disease, diabetes, all of those become aggravated and worse when an individual is trying to get well from influenza. Influenza actually lets off these cytokines that attack your heart and attack your lungs. And so it's the disease itself can make your other conditions worse. And so that's why it's bad for older individuals and for individuals with chronic conditions. And Lance, we're not hearing you here.
I just noticed that I was muted. Sorry about that. Yeah, so speaking to that, maybe say, why is it important to get a flu vaccine every year? I mean, if it's something we keep seeing over and over again, why aren't we building up an immunity to that?
That is a fabulous question. And actually, so many of us have become really great epidemiologists and understand, or virologists, because of COVID and what we've learned about it. And it's very similar. The thing that happens when you get a vaccine is you get an initial boost with your immune system that produces the antibodies that will protect you. And it takes a couple weeks for that to happen with the flu vaccine. But then two things happen. One is you get waning, where the immune system starts forgetting that it needed to be boosted up. And so your immune cells don't keep producing, and they're not as protective over time. So waning affects you. And with influenza, you get about 8 to 9% per month of fewer antibodies, and you get that waning immunity. Older individuals actually wane faster. So that's why you want to get vaccinated pretty close to the influenza season. The other thing, though, is why we do it every year, besides boosting your immunity every year, is where we're used to things called variants for COVID. We call those things subtypes. So a subtype is something that is a really big change. So that's where, like, when the big variant changes enough to make it so that the vaccines and our immunity doesn't recognize this new type of virus. And that's where we got things like the Spanish flu. So that would be the subtype. But the other one is called strains. And strains are just minor changes. You have a couple of proteins on the outside of the influenza vaccine of the influenza virus that our vaccines are supposed to recognize. But the next generation, when it replicates in your body, the next generation looks a little bit different. Like your kids look a little bit different than you. And so those those proteins move a little bit, and then they move a little bit the next generation, the next generation. And influenza has really fast generations. I mean, it's genetically mutating inside of you multiple times while you're ill. So what happens is we need to have we get these new strains of influenza that escape the vaccine and how it's designed to protect you. And so these new strains happen, and we select every year what's the strains that are circulating the most in the community, and they put 4 of those strains into the vaccine. And the next year, you'll have mutated a little bit, your new variant of the influenza, and they have to then create another vaccine that will recognize those new strains. So that's why we have to have every year a new influenza vaccine. Hopefully that isn't going to be as frequent with the COVID vaccine. That even though we've been having variants of it, the variants haven't shifted enough that we have to have a new vaccine. We just have to have enough antibodies to deal with those variants. And so at some point in time, we may have to shift the type of variant within the COVID vaccine, but we do need to do that every year with influenza.
Gotcha, that makes sense. And kind of along those same lines, we talk about that there's different flu vaccine options. There's flu shots, there's nasal, there's high dose. Talk a little bit about those and who those particular options are best for.
Okay, so for the injectable vaccines, those that we call flu shots, those are all indicated for people 6 months and above. And the only one that has a different age indication on that is the flu mist can be given to people who are ages 2 to 49. So that's where they do a little spray into both of your nostrils. And it's a modified live vaccine. So people who are immunocompromised or pregnant can't get that vaccine. But it's an easy way of getting it in a different method, and it actually protects that nasopharynx, which if you can protect that colonization, it prevents you from passing the virus on to other individuals. The vaccine that is a shot can be given either ages 6 months and above. There's one called Flu Cell Vax that's a cell that's grown in not an egg medium, but in a canine cell. And that one is only for ages 2 and above. We have 2 different types that are specifically designed for seniors whose body's immune systems, we call it immunosenescence. It's their immune systems get older. So when you're over 65, your immune system just isn't revved up and doesn't respond as easily. And the kids respond the best to vaccines because they have these really strong young immune systems. For older individuals, we have 2 types. One is the high dose flu zone, so it's just a higher amount of the antigen in the vaccine, and the other one is an adjuvanted one called flu ad, and it has a squalene. It's an adjuvant that connects to it's a different molecule that it tells the immune system, oh, something's different here. And so it helps it recognize that it needs to respond more than without the adjuvant. So that adjuvant boosts your immune response too. And we see those in hepatitis B vaccines and in the Shingrix for your shingles. All of those have adjuvants that help older individuals or people with immune systems that don't work as well to really recognize that this is something they need to create antibodies to. So those are the ones for the older individuals. There are a couple of vaccines that now have a new indication for allergies, and that's your flu block or your flu cell vax. And the new recommendations from CDC say, if you've had an allergic reaction to a flu vaccine, you shouldn't get another flu vaccine. That was the past recommendation. But that's still the case for most of the flu vaccines. But what you can do is, if you had a egg-based vaccine and had an immune reaction to it, you can still get flu cell vax or flu block. They don't contain any egg in them. And they're only indicated to have, if you're allergic to that specific vaccine, then you can't get that one, but you could get a different flu vaccine. Okay, so You do have some options now. If you've had an allergy to one flu vaccine, you ought to ask your physician, well, is there a different flu vaccine I can get? Because there are definitely other choices for you.
Excellent. So that leads to the next question, of course. When do community vaccination events start?
We already have uh, events going on right now in the community, and you can check your local health department websites. If you go to intermountainhealthcare.org/flu, you can find locations where our clinics are providing flu vaccine to individuals, and the so they're at your local pharmacies. There's so many different locations you can find them. You can go to your physician office, your local pharmacy. We give them in our emergency departments to individuals who are going home healthy enough to go home. We have them in our hospitals as people are leaving the hospital if they haven't had their influenza vaccine yet. So we're trying every place to possibly offer it to you. And if you're getting another vaccine, it's a great time to get your influenza vaccine. So if it's time for your COVID booster, you can go ahead and get your influenza vaccine at the same time if that location is offering both at the same time. The handling of the COVID vaccine is fairly difficult, and so you have to. There are only certain settings that provide that vaccine, but you can always ask if you're getting one vaccine. You can ask and see if at the same time they're giving the other one, and it's permitted to get both together.
Gotcha. And along those same lines, if you've got a cold or you're got a little bit of a runny nose or something, should you go ahead and get the flu shot or should you wait?
So here's the usual answer before COVID was if you are moderately to severely ill, meaning do you have a fever? Are you feeling pretty crummy and sick? Then you probably shouldn't get a vaccine on that day. But if you were mildly ill and had cold symptoms, you could go ahead and do it. The only problem is now we really don't want the people who are administering a vaccine to you to get sick from you, especially with COVID. So if it's something where you're concerned and you may have symptoms that could be a case of COVID, we really don't want you to come in on those days and get your vaccine. You ought to be tested to see if you have COVID or not, and then if you're COVID free, go ahead and get it. So and after you have had a case of COVID, 10 days after that, when your isolation period's up, you can go ahead and get vaccinated because you're not at risk of passing the illness on to somebody else.
Gotcha. And we got a question from one of our Facebook viewers talking about when drive-through clinics are open. We talked about that just a little bit, but will toddlers be able to get the vaccine through the drive-through clinics? We know sometimes they're a little more limited on where those are available. Can you speak to that and why younger kids may be limited a little bit?
Yeah, so it really depends on the seating and and what the individual place has decided are the criteria for who they will be providing vaccines to. So you really have to check with them and say, what ages are you giving the vaccine to? And are there any people that can't get it at this location? I think it's really an individual decision making. Do they have the right staff to work with the child? Do they have and do they feel secure in terms of providing that vaccine? So it really it's going to be site specific. It's best to check ahead of time before you provide that for your toddler. But toddlers definitely should be protected. We get kids hospitalized, and sadly, we usually have in the hundreds, 100, 200 children dying from influenza each season too. So it's something that the vaccine is great for them. It helps them build their immunity against influenza and protects them from some of the bad side effects.
I know a lot of our friends in public health also say that children and especially school is a great little petri dish for incubating disease as well. So by vaccinating our kids, we're protecting everyone else as well, I'm sure. So what about insurance? Does insurance cover the influenza vaccination?
Yeah, so Medicare, Medicaid, and commercial insurances should cover the influenza vaccine because those that are, uh, I think, Cobra related ones are they have to follow ACIP recommendations. So it's very rare to have an insurance that wouldn't cover it.
And then what if you don't have insurance? What options are available for those individuals?
I would have them check and make sure that there is a VFC program at the location you're going to. So if you're going to a clinic, make sure there are a Vaccines for Children clinic, or any of the health departments cover vaccines for children, because uninsured individuals, uninsured children can get the flu vaccine through the Vaccines for Children program. And the parent may have to pay a small administration fee, but the vaccine itself is free.
And we've got a question from one of our great media partners. I'm going to start it just a little bit different. He's asking, or we're going to start with, what about pregnant women and influenza vaccines?
It is really critical for pregnant women to get the vaccine, both to protect themselves from hospitalization. Um, just like COVID, women who get infected with influenza have a higher risk for hospitalization, have a higher risk for poor outcomes. But the other thing that's wonderful about giving the vaccine to a woman who's pregnant is that, especially if it's in the third trimester where their child is going to be delivered soon, babies can't get the influenza vaccine until they're 6 months of age. But the antibodies that the mom produces actually pass through the blood, the placenta, into the fetus right before they're born, and so they get protection. What the mom's protected against, the baby is. That's why when babies are born, they rarely get infections from their household members because the mom's already built an immunity to all the other viruses her kids are carrying around. And she's already passed that on to the baby to protect the baby. It's when people from outside your home come on in, that the mom's not immune to, that pass infections to a newborn. And so it's if you get the influenza vaccine when you're pregnant, you actually help in that first month or so protect your baby from influenza as well.
And then this is just a little different direction, but it's kind of along the same topic. The CDC has recently issued an urgent advisory for pregnant women to get the COVID vaccination. I assume that's works in kind of the same realm.
It is. I mean, because they have really seen, when we look at all those high risk medical conditions where people tend to end up more commonly in the ICU or have where we have serious long term hospitalizations, deaths. Pregnant women are one of those high risk conditions that should be getting the COVID vaccine, and it is safe. It is effective, and just as effective in a pregnant woman as in those who are not pregnant. But it reduces dramatically their risk of hospitalization, and they have a higher rate of hospitalization, pregnant women who are not vaccinated, than pregnant women who are vaccinated, and a higher rate of poor outcomes in terms of the pregnancy as well, with premature deliveries too.
Excellent. So maybe just coming back to influenza vaccines again a little bit. Is there anyone that shouldn't get a flu shot?
Um, and we used to say, if you've had an allergy to a flu vaccine, you shouldn't be getting one. But that's not necessarily the case anymore. So you really need to say, which of the flu vaccines did you have an allergic reaction to? There may be a different type of flu vaccine that you have the ability to get. So that's something that, again, to check with your physician so they can look at the types. And then the other thing is just age. People who are under age 6 months can't get the flu vaccine.
Speaking of reactions, what reactions would you expect from a flu vaccine, and what would maybe be more concerning to some people?
So the common ones, first is your localized reaction. Some people get a little bit of pain at the injection site for a few hours, maybe a little bit of redness or swelling. Those are less common, but most people don't have very much of any symptoms with the flu vaccine. The majority, but you can get some mild systematic conditions as well, such as you might have a mild fever, a little bit of achiness, and feelings of headache or fatigue. Those are the most common things that happen with the flu vaccine. All it is it's signs that your immune system's turning on. Those are the symptoms that happen when your immune system's doing its job and creating the antibodies that help fight an infection. The things that you would be concerned about tend to happen very quickly. They would be immediate reactions of hypersensitivity, where you have allergy type symptoms of, and those are the ones that we would have to treat. So, if you have these symptoms in the first couple of hours of getting a vaccine, you can have shortness of breath, you can have feelings of a high feeling of anxiety that something's not right, and people can have nausea with it. The biggest concern, and you can have rashes or hives or a difficulty swallowing. Those are the types of things that, when it looks like it's an allergic immediate reaction, should be treated in a medical setting. But those again are very, very rare.
That was going to be my question. I didn't know if you knew off the top of your head how often those kinds of reactions do occur.
Well, if it's a true anaphylaxis, that's where you have a really serious allergic reaction that needs epinephrine or an injectable treatment for it. It's an emergent condition to keep you so you're breathing all right. Those happen in 1 to 2 cases per million doses. So these are very rare.
Okay, on the other hand, if you get influenza, um, I mean, some people say, "Oh, I don't need the shot. It's not flu, isn't that big a deal." Talk about the impact of disease and the symptoms that that could experience from there.
Yeah, so the influenza itself is not your typical cold. It's and sometimes it's hard to actually differentiate between influenza and COVID. They have very similar symptoms, symptoms of high fever, aches, chills. Um, it, uh, Individuals have shortness of breath, and not as much the shortness of breath, but more they will get the cough with influenza, and then these are the symptoms that they put you in bed. These are, the shaking, chills. You will be in bed for several days, up to a week. You lose work. You can't go to school. It really kind of knocks you out. Influenza. There's a spectrum. Some people have a milder case, and some people it lands them in the hospital on a ventilator. And we have people who die from that as well. The other thing is we have a higher rate of people who have the tendency towards a heart attack. Those cytokines that your body develops because of the influenza can attack that heart, and we get higher rates of people having heart attacks, and their heart failure gets worse, and their diabetes gets worse. All of these chronic conditions worsen when you have influenza. Your asthma gets worse. All of those types of things. So it can go anywhere from being in bed for a few days to landing you in the hospital.
Great. I guess that's the other reason why we want to stress flu vaccines is we don't want to have people landing in the hospital with influenza and people side by side with COVID. Um, we've got a couple questions here. I'm not sure that this is one you're going to feel comfortable with, talking about COVID hospitalizations, and the Delta variant seems to be peaking, maybe even on a downswing. Do you have any information about how the hospitals are looking at that at this point,
Yeah,
or?
And I think I may know where that's coming from. That yesterday there was a big dip in the reported number of hospitalizations, and I think that what they ought to, the individual checking on the question should check with our health department. I do think that that's a probably an aberrant data point because it was such a dramatic drop. We are seeing no decrease in terms of our hospitalized patients here at the Intermountain Healthcare System. And occasionally, what you'll see is on a day a little bit of a drop because if you look at that same day yesterday, we had over 1,700 new cases of COVID. So that looks like it's on an upswing. It really is, I think, a matter of the ups and downs that you see daily. I would estimate that they will see the numbers back more towards where it was in the next day or two. But they really ought to be checking with the public health department to see if they want to check on that. But I'd say probably wait a day or two, and I don't think they'll be seeing that much of a difference in terms of hospitalization rates.
Gotcha. Good place to check for that information, of course, is coronavirus.utah.gov. You can also track other respiratory viruses from GermWatch. Germwatch.org is from Intermountain Primary Children's and University of Utah um, epidemiology specialists that are tracking what's going on in the environment. So, okay. So, lastly, are there any closing recommendations you'd like to give to our viewers?
Yeah, I'd really like to kind of stress to them the need to get the vaccine for a couple of reasons. And overlying it is just for your own peace of mind. There are things that benefit you, and there are things that benefit others. What you're looking at is if you get the vaccine, you know you've done everything you can to protect yourself and to protect your loved ones around you. So it's I think, and the other part of that peace of mind is, if you get the flu, you're going to have to go in and get tested for COVID because the symptoms are so similar, and that's going to take up our testing resources. If you get the flu, it may land you in the hospital, and that takes up our hospitalization resources. So for you individually, and for us as a healthcare system, we need you. We need you to help us so that we can help you. We really are concerned that we don't want you who may have an appendicitis or you who may have a heart attack to run into the condition where there's not a bed for you. And we need everybody out there to vaccinate for influenza so we're not filling up those beds with influenza cases, and vaccinate for COVID so we're not filling up those beds with COVID cases, so that if you do have another condition that you need us at the hospital, we're there for you. And I think so it gives you peace of mind. If everybody in the community is doing this, then we can handle these very serious viruses. The other thing is just to be kind, because you can be a case where maybe you're healthy enough that it's just going to make you sick for a few days. You may miss work, you may miss school, but you may pass this on to another family member who has a medical condition that won't be quite as lucky as you and may end up in the hospital. You may pass it on to a neighbor who they just don't have a good immune system. They may be going through cancer treatment, and the virus can kill those individuals. So please, please, please be kind and do it for others. Give yourself your own peace of mind and do it for yourself.
Well, thank you, Dr. Sheffield. Once again, it's Dr. Tamara Sheffield, Medical Director for Preventive Medicine with Intermountain Healthcare. For more information regarding vaccines and location, you can go to intermountainhealthcare.org/flu. You can also check with your personal physician or the local health departments who are more than willing to help out and give you good information. So be safe, everyone out there. Get your flu shot, wash your hands, and stay home when you're sick.